Okay, so this is Rebecca. I'm going to be doing my physical and nervous system exam on her. First I'll inspect her head and neck. I'll inspect the musculature of her face and look at her neck symmetry, which all seems to be intact. I'll have you open your mouth and close it, and then move your jaw from side to side. That's perfect. And then I would palpate her temporal mandible joint for movements and sound. And then have you rotate your jaw again. Yep, and I'd be feeling to see if there was clicking. There wasn't. I don't feel, I hate this. Do you have any tenderness when I was palpating here?
No.
Any soreness
No.
or tenderness? Okay, and then I'll have you move your neck from side to side and front to back. And how does that feel? Any tenderness or pain or soreness?
No.
Okay, and so I'm going to have you press against my hand forward, press against the back, side to side. And then I would rate the strength, and she has full strength and full range of motion, so I would rate that as a +5. Next, I'll assess her spine for alignment. I'll have you go to the side. And so I would assess her spine for alignment. I'm expecting for symmetry and range of motion. I noticed that in her cervical area, it's concave. When we get to thoracic area, it's convex, and then it goes back in concave for the lumbar area. And I would palpate her spinal process here to see if there was any tenderness and how the alignment was. Her spine feels pretty straight. How does, is it tender at all when I press?
No.
Okay, and then to test her range of motion, I would have her bend forward, backward, and that is hyperflexing, hyperextending, and then I'll have you go from side to side. And then if you put your hands down at your waist, bend down to your right and then bend down to your left. And so it looks like she has full range of motion there. And then when I had her bend forward and back, that was testing the range of motion of her spine. So if you want, you can sit back down. I'm going to inspect your shoulders for equal. Looks like maybe your right's up just a little bit. I'm going to inspect your wrists and your hands for firmness. I'll have you press against my hands and press up and then back and forward. I'm going to palpate your shoulders and your wrists for tenderness and swelling. I don't feel any swelling. Do you have any tenderness?
No.
And I would do that bilaterally. And then I would observe range of motion in her shoulders, elbows, and wrists, which I already did that by having her move, and then your shoulders up and down. That's all good. I'll test for muscle strength, and then I'll push down against it. It feels like she has a nice +5. She doesn't have any issues moving. Her range of motion is good. To check for range of motion in her finger, I'll have her move her thumbs in and out. I'll do the OK sign, have her do the OK sign and try and pull apart, which she doesn't. There's no deformities or nodules when I inspect here. There's no swelling or bogginess. To test for carpal tunnel, I would do the Phelan sign, so I'll have you put your wrists together. Normally you would do that for 60 seconds, and you would find out if there's numbness or tingling, and if there is, that would be positive, and that would be something to follow up with a doctor. You can put your hands down now. And then for the Tunnel's sign, I would check her median nerve here, and then I'd just tap it gently, or maybe a little not so gently. Do you feel tingling or numbness when I do it? No. And then I would do that bilaterally. Then I would go on to the lower extremities. I would inspect her knees, feet, and hip for symmetry, and I would have her flex, bend her knees, do abduction and adduction. I guess I'll hold the camera and do it. That way I can have her do it really quick. So if you can stand, I'll just have you, actually in the video they did it laying down, but just raise your leg up and down, and then we would do it side to side and have her bend up and down so that to get the adduction and abduction and flexion and all that, I would be testing for that. I would be doing it on a table, so she would be laying down, but that's how I would do that. Then I would palpate her knees and hips and ankles for stability, tenderness, and edema. So I would pull up her pant leg and I would check her ankles. She wouldn't have socks on, and I'd be doing that. Then I would be looking at the range of motion for her ankle. Yeah, so if you want, you can just move your ankle around. Very good. I'll have you press against my hand and then pull up. Do you have any pain or soreness with doing that? And then I would do that bilaterally. She's all intact. Her strength is good. Her range of motion is great. Then I'd move on to her nervous system. I'd be assessing her level of consciousness, and I'd be evaluating her when I first walked in the room to see if she was alert and oriented. And then I would be testing her olfactory, which is cranial nerve 1. I have essential oils not with me, but I would have her smell it and pretend to tell me what it is.
Peppermint.
Yes, that's exactly what it was. So she got that right. And then next I would be assessing for her visual acuity, cranial nerve 2, which is the optic nerve. I would have her do the Snellen chart. So I would have her read this piece of paper 14 inches away and just have you read the top line here, or that middle line there.
Inspect the spine for alignment.
Very good. So she would do that, and then if that was difficult for her, obviously I'd recommend she follow up with her optometrist. And then I would go on to assessing cranial nerve 3, 4, and 6. I would be checking for her peripheral confrontation by having her clench her teeth, and I don't remember where my train of thought was going there. So basically what I would first do is I'm gonna have you look straight forward, and then I'll wiggle my fingers and you can tell me where you see them.
No.
And then I'll do that coming from this side.
No.
And then up. And then I would do that with her eyes covered, one each eye covered. I'm not going to do it in the interest of time for this video. And then as I keep going, there was something I had told myself I was going to do, and I can't remember. Then I would assess with my flashlight. I would check her eyes. If I had my little flashlight, all that stuff's at work. And I would assess for constriction, whether her pupils opened equally, what size they were. 3 millimeters is normal, whether they were round and reactive, or if there was any off shape, or if they were symmetrical or not. And then I'd also have her follow my finger and make sure she's able to follow it well, which she does. So those are all within normal limits, good signs. I would assess for facial symmetry by having you raise your eyebrows, puff out your cheeks, clench your teeth, and smile. And her face is very symmetrical, which is good. If it wasn't, I might be concerned about a stroke or some other lying neurological or muscular disorder. And I also want to check the extraocular movement, which we did when she followed my finger. When I get to cranial nerve number 8 to assess her hearing, I would do a whisper test. So I'm going to whisper something in her ear. I would do that each side, and then she would tell me what 3 words.
The dog is cute.
So she passed the whisper test, and then I would do the Rhine test, and I would be checking for bone conduction and ear conduction. So I would do the Rinne or Rhine, whatever it is, and Weber test with my simulating tuning fork. I would ding it, and then I would put it close, and she would tell me when she could hear it.
No.
And then I would do it from up top. And so then I would have my little sheet, and I would be doing the correct calculation. I would figure out how the conduction was, and if there were any discrepancies, I would have her follow up with her audiologist. And then I would go on to the cranial nerve 9 and 10 and check for a gag reflex and for the soft palate. So I would have her open up her mouth. I would shine my light in. I would check to see if everything was symmetrical, and if her tongue was symmetrical and midline, which it is. And I would also, if I had a tongue depressor, and I'm not going to do it here because I don't want to gag her, but I would tickle the back of her throat to make sure she had the gag reflex. Then I would go on to cranial nerve number 12, expect for tongue movement, which I actually already did with 11, but I would expect for tongue movement, symmetry, and I would look to see if there were any tumors or sores in her mouth that needed to be addressed. So then going on to the motor system, I would observe for gait, balance, and coordination. So I'll have you stand up, and then I'll have you just walk back and forth. You can and come back. And so I would have her do it further in the office or in the bedroom, or the hospital bedroom. And I would be checking to see how her gait is, and I'll have you do the same with heel to toe. And she does that well. You can't see it in my video. I'm not a very talented videographer. And then you can sit back down. I would have her hop on one foot. I would have her to do the heel to toe. She just did that. And then the next thing I would do is, I would do the Romberg test, where I had her close her eyes and stand. And then I would see if she flowed. That's the palmar drift. When her hands are out, I would look for her hands drifting. And then the Romberg test is when she stands with her eyes closed to see if she swerves one way or the other. And a little swerving is normal. Palmar drifting, her hands should stay out, and if they do stay out at the front, that would be negative, and if it was positive that they drifted, that would be something to address further. So the next would be the rapid finger nose test. So I'll have you take your finger and point it to your nose, back to your finger.